Good morning, everyone. Many thanks to our quartet, our Cooper's own quartet, I should say. Today's Grand Rounds is a joint effort of the Department of Medicine and CMSRU, and many thanks to Lisa Churcheo for helping to arrange this and also for leading the quartet. Dr. Philip Mackowiak, our speaker today, is currently Emeritus Professor of Medicine and the Carolyn Frankel and Sylvan Passon History of Medicine Scholar in Residence at the University of Maryland. He is a Master of the American College of Physicians and a former governor of the Maryland chapter of the ACP. A graduate of Bucknell, followed by the University of Maryland Medical School, he also received a master's degree in business administration from Johns Hopkins, and his early career began as an EIS officer with the Centers for Disease Control in the early 1970s. So I think you could guess his discipline as an infectious diseases physician. In 1975, he joined the faculty of the University of Texas Southwestern Medical School in Dallas, where he rose to the ranks to become a full professor of medicine, and then went on to join the faculty of the University of Maryland in the late 1980s. Throughout his career, he's been recognized repeatedly as a teacher and a mentor, and on many occasions received accolades, major accolades from the graduating students. He's published over 150 peer-reviewed articles, editorials, and book chapters, including several treatises on the treatment of fever. For several decades, he's hosted an internationally acclaimed series of historical CPC conferences in Baltimore that led him to develop 2 books. And in recognition of one of those books, he was the recipient of the American College of Physicians 2010 Nicholas E. Davies Memorial Scholar Award for scholarly activities in the humanities and the history of medicine. He is considered one of today's most accomplished medical historians. So please join me in welcoming Dr. Mackowiak.
Well, thank you, Dr. Riboli. It is an honor to be here, particularly so, and I want to congratulate Dr. Katz and crew for getting so many people here at 7 o'clock in the morning. I shudder to think how many people would show up if we were doing this at the University of Maryland. The speaker and maybe the second speaker, I would think. So let me begin by giving you my potential conflicts of interest. I really don't have any not because I didn't want to have any, but nobody would pay me to have one, so I had to make up one, and that is that I shamelessly promote these 2 books based on the historical CPCs you heard about, and I've gotten rich doing that. As a matter of fact, I've made so much money that I could take Dr. Churcheo out for lunch if one of us paid our own way. But we're not here to talk about that. We're here to talk about Beethoven. So that'll work. And this will this will be a bit of a letdown after that performance we just heard. Now, that was a piece that was Beethoven's piano quartet number 3, which he wrote at age 15. Now, in the literature review that I did, it was said that he was not a prodigy of the ilk of, say, Mozart. I don't know how anybody could write something like that at age 15 and not be a prodigy, but as you'll see, he was a prodigy primarily because of his virtuosity at the piano. But in any case, Beethoven lived from 1770 to 1827. This was important in terms of, as you'll see, his health record. This was an age of revolution. There was the American Revolution, the French Revolution, and the Napoleonic Wars, which were extremely important in Europe at the time. It was an age of enlightenment. There was a new skepticism that pervaded Europe and a spirit of inquiry. The vast bulk of the population were dirt poor. There, however, were a few who were very rich, and they had a passion for conspicuous display and supported people like Beethoven in their efforts. Thank heavens for that. Monarchies were absolute, child labor was widespread, strikes were brutally suppressed, medicine was virtually useless. Now, we think medicine today is wonderful and can do anything. We could have another grand rounds on that issue. Medicine at that time focused almost exclusively on comfort measures when medicine did good. Infant mortality was 60%. There were outbreaks of cholera and typhoid. However, the two major disorders of that era were actually smallpox and syphilis, and I will get back to the latter. Bloodletting with leeches and other forms of bloodletting were commonly used, as were water treatments. Paris was the intellectual capital of the world. However, Pasteur's work was 50 years in the future and hence was not available to prophet Beethoven. Now, this is what Beethoven looked like at the age of 30. He was actually a fairly handsome guy as a young man. But even then, he was far from healthy, as you'll see. Now, anybody who knows anything about Beethoven knows that his most spectacular feature of his multifaceted disorder was the fact that he went deaf. Now, when the problem began, we don't know for sure. Possibly began as early as 15 when he was composing the piano quartet that we heard. But what is clear was that his evolving deafness first came to his attention at age 26. Initially, he ignored it. He thought it was transient, that it would get better. Particularly so because his left ear was less affected and sustained him for a while. But by the age of 36, it was obvious to him that it was relentlessly progressive. In addition to the evolving deafness, there were other symptoms. There was tinnitus, had this horrible ringing in his ear all the time, and you can imagine how difficult that was for him. Loud sounds caused pain, and so if anybody shouted, it was almost unbearable, at least early on, before he went completely deaf. He resorted to a number of people and a number of treatments in an effort to try to reverse the problem and relieve some of his symptoms. There were various drops, tonics, and herbs that were given. Blistering agents were applied to his extremities. Only cotton in the ears seemed to help to the extent that the cotton in the ears reduced this horrible tinnitus that he was having. By the age of 51, he was completely deaf. Now, you may think that his problem was singularly ironic, but in fact, Smetana, Fauré, and Franz also went deaf during the course of their career. So by the time he reached his 40s, his deafness had reached the point where he couldn't hear well enough to communicate with people who came to visit him. And so he would speak to them, and they in turn would communicate him by writing in his conversation books. And these are available, and there's some 40 plus of these conversation books from which the information that we have about his illness is derived. That, along with a diary he kept in his 30s, and also his Heiligestat Testament, which I will get to next. So these were some of the ear trumpets he used, the actual trumpets he used as his deafness was evolving to try to hear what was going on around him. So his reaction to his deafness was just as you would expect, particularly being who he was, a person whose life was hearing music. Initially there was anxiety, then grief, and then finally despair, and you can see it in this this charcoal image of him sort of wandering in the fields. When he's 32 and working on his second symphony, he writes the Heiligestat Testament. And this is a sort of a strange letter he writes to, mostly to his brothers, but to the world in general, to explain to the world that he is not by nature misanthropic, that his disorder has caused him to retreat from sort of social interactions. And it's also, he mentions suicide. I mean, he is very depressed at the time. And it's a will of sorts. He tells his brothers what he wants them each to have, and he wants them to love and take care of each other. And so this is a time when he is socially isolated. What effect this deafness had on his creativity is a subject of great speculation. And what effect his illness in general, which you'll see was multifaceted, had on his creations is also a subject of speculation. So just as something for you music lovers to look into is that the fourth movement of his second symphony supposedly is a symphonic depiction of his GI disorder. Borborygmi early on in that movement, and then flatus toward the end. Now, I've listened to that fourth movement, and I don't hear that, but there are musicologists who say that it's there. So you might, a Cooper quartet, you might take a listen to that and see what you think. So as you can see in this depiction of Beethoven, when his hearing was gone, he became a tragic and a comic figure, hurrying through open fields from which he drew his inspiration, gesticulating and singing loudly to himself some new melody heard only in his mind. He was a strange-looking fellow at that time. So, as I said, anybody who knows anything about Beethoven knows about his deafness. Few, unless you have taken some time to study his life, would know that his deafness was only one aspect of this multifaceted disorder which plagued him virtually his entire life, certainly from his early teens to the end of his life. And his deafness was not the most important in terms of that aspect of his illness that killed him. So he had recurrent diarrhea and abdominal pain almost from the start, certainly from his teenage years. And so diarrhea and abdominal pain, and I could find no evidence that constipation was part of his illness. And this is important because of the possibility of lead poisoning, which causes abdominal pain, gastrointestinal problems, but characteristically is associated with constipation, not diarrhea. There was smallpox as a child, and he had a pockmarked face, and supposedly the smallpox affected his eyesight as well. By the time he reached his 30s, his health is definitely bad. And you can see listed here, there were intermittent fevers, and I'm not talking about a case of upper URI now and then, or even a case of flu. We had recurrent intermittent fevers that sent him to bed for weeks on end, feverish catarrhs, upper respiratory symptoms, and tormenting headaches that came and went and were totally disabling, that we would call severe migraines today. And then there was rheumatism, and again, more of these upper respiratory symptoms. And the rheumatism was multi-articular, came and went, just like what am I trying to say? Rheumatoid arthritis, exacerbations and remissions, but there was never any deforming of his joints. So it was a non-deforming polyarticular arthritis. And then by the time he reaches 50, his health is clearly totally unraveling, with recurrent episodes of jaundice, again, coming and going, a painful inflammation of his eyes that we would call interstitial keratitis today. That is, he's got pain, he's got photophobia, and it is so severe and protracted that for weeks on end he'd have to retreat to a dark room, sometimes bandaging his eyes before he could come out and tolerate the light. And then finally, in his mid-50s, the end is near. He starts bringing up blood from his nose and probably from his GI tract, hematemesis. So, and yet during this entire time, his creative abilities never flagged. So during his final years, he produces the Ninth Symphony, not the absolute final, but toward the end. And this is important to reflect upon, because when you see the results of the post-mortem examination that was done on him, there's evidence of cerebral atrophy. And I'm reading this and I'm wondering, how could this be? So when we have a complicated case like this, we look at all aspects of the patient's history. So we go to the family history, the social history, etc., looking for clues. So are there any clues? Well, this is his father. He was a music teacher, and he did instruct Beethoven, but he did it in a willful and brutal manner and took advantage of Beethoven's virtuosity on the piano. He was a tenor of modest ability, but perhaps most importantly, he was a two-fisted alcoholic. And that was a problem. Now, he died at age 52 of heart failure when Beethoven was 27. The source of his heart failure is not known. Possibly was dilated cardiomyopathy due to alcohol. His paternal grandmother, this man's mother, was also an alcoholic. So there was alcohol a problem in the family. His mother, by comparison, was upright, brave, and stable. Unfortunately, she was also tubercular and died at age 40 when Beethoven was 16, leaving him to the total parental guidance, as it were, of his father. Her mother was feeble-minded. There were 6 siblings. So Beethoven and 6 siblings, only 2 of which, 2 brothers, survived infancy. Beethoven's older brother, who was also Ludwig, and Beethoven followed, and the name was given to the next living child, as was the tendency at that time, died at 2 months of age. His next youngest brother, the one who survived, developed TB and died at age 41, leaving a nephew to Beethoven's care who caused him a great deal of angst and difficulty. And he also had a next younger brother who was an apothecary. And the evidence is that he provided him with analgesics, probably some salicylate formulation, to treat his migraines. And as you'll see, that may be critical to what was found by way of kidney abnormalities. So this was the house in which Beethoven grew up in Bonn. He was born in Bonn. The family actually came originally from Belgium. He lived in Bonn until age 21, and then he moved to Vienna, where he basically spent the rest of his life with week trips elsewhere, mostly out into the country. This is a silhouette of him as a child, and as I say, he was a prodigy. At age 15, you saw what he was able to do, but he also was a pianist. As his deafness evolved, he had to give up that latter aspect, that latter talent, and concentrate on his compositions. He drank a great deal of wine late in life. There's no evidence that I could find that he was drinking as much early on. And so that here again, getting back to lead intoxication, where the source of chronic lead consumption would probably have been wine in those days, although there are other sources, he was not drinking at the rate one would expect if his initial GI complaints were due to lead intoxication. He craved the tranquility of the countryside, and so the question of Lyme disease comes up, but it's possible that maybe his joint problems or something were due to Lyme disease, but couldn't explain all the other aspects of his multifaceted disorder. So what about his social life related to his sexual activities? So some assume that he was above the more obvious frailties of the flesh. And on cursory examination, he seems to have hungered only for music, books, and conversations with men and women of taste and intelligence. Probably not. And I'll get into that, but we tend to create images of our great people of history that really don't coincide with fact. In fact, his friend, his best friend, Wegeler, said of him, he was never without a love and deeply engrossed in it. And it's clear from his biography that he was attracted to women already firmly attached to other men, perhaps because he regarded love relationships as impediments to his creative mission. That would seem, at least to me, seem to be a reasonable explanation for why he never married and why he was so flitty in terms of his interactions with women. This portrait right here is Countess Giulietta, possibly the subject of his famous Immortal Beloved letter. She was the wife of Count Gallenberg, a prolific, although minor, composer who Beethoven came to know and perhaps love. So this is what Beethoven looked like at age 54. I would think probably not. I think that this is an idealized image of Beethoven because he was desperately ill at this time, and he looks like a healthy, robust guy in this portrait. So This is about the time when his health begins to totally unravel. He's having a recurrence of his attacks of abdominal pain and diarrhea, and his eye disorder, his interstitial keratitis almost certainly. And so finally he decides to accept an invitation from his brother, the one who is living, the apothecary, to go to his brother's country resort at Genexenberg, just outside of Vienna. And perhaps he delayed that long because he sensed that this was going to be his last trip. I'm sorry, that's Genexendorf. But in any case, he goes, and it's out in the country. And the country air initially seems to do him good, at least to the extent that his eye pain improves. And while he's there, his routine is the following. He gets up in the morning at 5:30, which I had to do this morning. I mean, it's inhuman what we have to do. But in any case, I did it. And he would get up at 5:30. He would go down to the kitchen, sit at the table, and he's banging the table with his hands and stomping the floor with his feet and singing melodies at 5:30 in the morning. You can imagine what his brother was going through every morning. And then he would spend an hour doing that, and then he would go out and wander in the field, gesticulating and carrying on. The peasants thought he was crazy and kept out of his way. But in any case, things seemed to be improving, and then they got bad. There was a worsening of his diarrhea, and his abdomen began to swell, and his feet, which had been puffy, began to become massively engorged with edema. Initially, he wrapped bandages around his abdomen to try to do something about this ascites, which was developing. That didn't work, and because things just continued to deteriorate, he decides, I got to go back. I got to see my physician in Vienna. This is late November. It's cold and damp, and he makes the 2-day trip in an open wagon, and with a one night spent at an inn on the way. When he arrives in Vienna, he's got pain in his side and he's coughing up blood. Now, interestingly, at post, his lungs are normal. So the pain in his side, I guess, was probably his liver, and the coughing up blood was probably hematemesis rather than hemoptysis. But they thought he had pneumonia, and they treated him with some sort of anti-inflammatory preparation. And initially, he gets better. However, shortly thereafter, and this is over a course of about 2.5 months as he's circling the drain, his ascites increases in size, his jaundice gets deeper. And when they examine him, and this is one of the sort of the tidbits in the historical record that's hard to reconcile with what's going on, is that the physicians examine him and they think they feel a nodular liver. I mean, he's got massive ascites, and at post his liver is shrunken, but nodular, and they claim they can feel nodules. Any case, his ascites become so massive that he's having difficulty breathing, his urine output drops, and so they decide they need to do paracenteses, and they use a silver trocar and take out 5 liters of fluid. Initially, it's cloudy, but then it becomes clear as they do repeated paracenteses 3 more times, and you can imagine what it must have been like for him. It relieves his shortness of breath. He feels somewhat better, but that puncture hole, those puncture holes in his abdomen after that are leaking acidic fluid into his bed, and it was awful to contemplate. So ultimately, 2.5 months later, after he returns to Vienna, he slips into a delirium and He's mumbling incoherently. Supposedly, and this may be apocryphal, shortly before he dies, he mumbles, Plaudite amici commedia finite est. This is a ancient Roman statement that was written into the end of plays. Applaud, friends, the comedy is over. And then he dies. And he dies on March 26, 1827, at the age of 56 and 3 months. Now, during this final phase, again, he completes the last, and in the minds of many, his greatest string quartet, peoples. That is Opus 131 in C sharp minor, just about the time his health collapses. So this is one of the quartets that Stravinsky rated as beyond the impudence of praise. I love that. So I mean, these are great quartets. As I think the one he did at age 15 is just wonderful. Whoops. Let's see, go previous. Okay, so the autopsy, which I've referred to repeatedly. Autopsy revealed a great deal about the anatomy of the disorder, but not the name. And so there's been great controversy as to what his problem could have been since then. As expected, the ears were abnormal. There's a thickened tube where the membrane was abnormal. The nerves around the eustachian tube were also, the vessels were also abnormal. They were thickened and abnormal. The nerves themselves, both acoustic nerves, were shriveled to the size of a very small thread. They'd been totally destroyed. There was evidence of cerebral atrophy, as I've mentioned. Well, how do we know that? Well, here's what was written in the postmortem. The convolutions of the brain were full of water, deeper, wider, and more numerous than normal, suggesting to me either he had a unique brain, or there was cerebral atrophy caused by whatever was destroying all those other organs. The skull was thick and dense. There was hypertrophy of the skull. There were 4 quarts of turbid ascites. There was macular nodular cirrhosis, where the nodules were the size of a bean, presumably a lima bean. The spleen was twice normal. The pancreas was abnormal. It was hard and lumpy, and the pancreatic duct was abnormal. And interesting, in the kidneys, there were found calcium deposits in the calyces the size of a split pea, suggesting that he had problems with the analgesics that he had been getting. So you would think that the autopsy could have provided a diagnosis. Anyone we would give him would have to explain all the, any one or number of ones we would give him would have to explain all these abnormalities in this multifaceted disorder. The other thing to mention is that they took a sample of his hair at the time of his post, and it found its way to San Jose State, California. They got it in a little crystal container. It's like one of the holy relics. And they did an analysis of the hair, and they found levels of lead 100 times normal. There was no mercury in that sample. So one would, again, have to give some thought to the possibility of chronic lead intoxication, and I'll get back to that. So what are we dealing with? We're dealing with a protracted, multi-system disorder beginning in Beethoven's early 20s, probably earlier, and culminating his death at age 56. For him, the most distressing feature of the illness was its effect on his auditory nerves, which it left shrunken and useless after years of pain and ringing in his ears. Interestingly, he had no vertigo, which one frequently sees where there's acoustic neuritis. The disorder's most lethal effect, however, was its destruction of the liver, which it rendered fibrotic and riddled with nodules visible to the naked eye. Probably fits the definition of macronodular cirrhosis, causing secondary ascites, an enlarged spleen, nosebleeds, and bleeding esophageal varices. These were the dominant features. However, there were myriad other features which have complicated efforts to arrive at an underlying diagnosis. There were the decades of intestinal complaints characterized by recurrent abdominal pain and diarrhea, the pulmonary attacks of bronchitis and feverish catarrhs, yet with no abnormalities found in the lungs on postmortem exam, the repeated episodes of rheumatism and painful eye inflammation, and the tormenting headaches, and the post-mortem abnormalities of the brain, pancreas, and kidneys. And then, of course, there was also smallpox and typhus, which he had as a youngster. And so what could possibly have been the cause of this multifaceted disorder? Well, one possibility is that it was not a disorder, but multiple disorders, all coalescing in one unfortunate soul. And all sorts of possibilities have been offered, and most of you have probably seen one or more of them that appeared in articles and letters to the editor. A short list is given here. I just want to touch on 4 of them. So, syphilis, I'll talk about in detail. Typhus was one of the causes that Beethoven attributed to his deafness. And he felt that way because he had an attack of a severe febrile disorder, possibly typhus, about the time he noticed the onset of his evolving deafness. And typhus can affect the acoustic nerve. It can cause deafness, but if it does so, it does it all of a sudden. It would not cause a progressive disorder of the acoustic nerves over several decades. So I don't think typhus is a reasonable explanation. Analgesic nephropathy, clearly he had papillary necrosis, as evidenced by the calcifications in his renal papillae. And the reason for that was probably the analgesics he was getting from his apothecary brother. Now, how about lead intoxication? I've already indicated that I'm not attracted to that particular diagnosis because more commonly it causes constipation, along with abdominal pain and diarrhea. Lead is toxic to nerves, but most of the cases of lead intoxication are associated with palsies, not sensory deficits, although it's possible. But here again, Beethoven's symptoms began before he was apparently consuming substantial amounts of lead through lead intoxicated wine. Now, as far as the hair analysis is concerned, interpreting the results of hair levels of lead, it's just fraught with, it's impossible, because you never know for sure whether it's external contamination. You don't know where the lead is. You can't, say, section the hair and see that it's internal so that it came from within. But all in all, lead intoxication is a poor explanation for the multifaceted disorder, but is a reasonable explanation for some features of that disorder. Now, to my way of thinking, the only disorder, if there was a single disorder responsible for most, not the papillary necrosis, but most of the other aspects of Beethoven's illness, it would have to be syphilis. So just briefly, when I refer to my own experience as a superb infectious disease consultant, nothing in my experience brought to mind any illness like Beethoven's. And so I consulted neurologists, I consulted ENT people, and none of them had ever seen or heard anything like this, that, in particular, that progressive deafness. However, if you go back to textbooks that were written before the advent of antibiotics, this disorder was pretty common. And when it occurred, this evolving deafness over the period of time we saw with Beethoven, it was almost always diagnosed as syphilis. And that doesn't mean necessarily it was syphilis, because we didn't have the definitive test, the Wassermann, until some 60 years later. But they were good clinicians, and what they attributed to syphilis were all these things you see here that were features of Beethoven's illness. Now, let me just say a word about a couple of them. So, acoustic neuritis destroying his nerve, uncommon. Less than maybe 1% of patients with untreated syphilis in the pre-antibiotic era developed acoustic neuritis. If there was evidence of CNS syphilis, it goes up to 2 to 4%. And if the patient was afflicted with congenital syphilis, it went up to 10%. You say, congenital syphilis, what? At least he didn't notice his problem until he's 26. How could that be congenital? Well, again, if you read these textbooks, the deafness almost never appeared until after puberty, and was always bilateral. So I'm inclined to think that if Beethoven had syphilis, it was probably congenital. There's chronic vasculitis, chronic meningitis, explain the headaches and the cerebral atrophy. Macronodular cirrhosis was seen and was potentiated by alcohol consumption, which Beethoven late in life was consuming in great amounts. Osteitis, very common, and had a predilection for the skull for some reasons, and would explain Beethoven's skull, which was thick and dense. Rheumatism was common, and again, as I said, had features identical to rheumatoid arthritis, except there was no joint deformity. Interstitial keratitis, which Beethoven had later in life, was common, particularly in congenital syphilis. So again, moving me in the direction of congenital syphilis. Chronic pancreatitis, irritable bowel syndrome, extremely common in these cases, and when you took them to post, the gastrointestinal tract was normal. It was thought that the symptoms were actually due to involvement of the vagus nerve. So if Beethoven developed syphilis, how could that have happened? Well, his mother, as we already said, was upright and a solid woman, but her husband was not. And so if he introduced Treponema pallidum into the bloodline, it certainly would have been the first time that an alcoholic in Europe at that time had dallied with prostitutes and brought home that organism. So what about Beethoven? Could he have, what's the evidence that he might have been exposed during his adult years to syphilis? Well, here's what Thayer said. Now, Thayer wrote the first extensive biography, and he was an apologist. All he would say about Beethoven's sexual indiscretions are listed here. The present age must be content to find in Beethoven, with all his greatness of very human nature, one which, if it showed extraordinary strength, exhibited also extraordinary weakness. In those years when the strict regulations of the school would have compensated in some measure for the unwise, unsteady, often harsh discipline of his father, he was thrown into close connection with actors and actresses. Things haven't changed much, have they? Who in those days were not very distinguished for the propriety of their manners and morals. That he never succeeded in governing his passions with absolute sway was not because the spirit was unwilling, the flesh was weak. Well, what's he saying? Well, if one looks at the conversation books, one finds conversations dealing with prostitutes and other willing women, which his associates apparently procured for him from the Haymarket district of Vienna, which was the prostitute section. Also, there's a reference in his book entitled On the Art of Recognizing and Curing All Forms of Venereal Disease, suggesting that his interest in venereal diseases was not simply academic. So I would suggest, based on my review of the clinical record, that Beethoven's disorder was most likely congenital syphilis for the reasons I mentioned, although there are many who would vehemently argue with me to the contrary. And part of the reason why they would do that is because, unlike more exotic disorders offered over the years as Beethoven's diagnosis, syphilis is a disease at least some would consider too banal, too unbecoming to have extinguished the life of this remarkable patient. Even in his own time, Beethoven was rightly regarded as one of the Illuminati, and his stature has only grown with the passing of years, engendering a growing reluctance to accept the possibility that this extraordinary man might have died of an ordinary disease. The very thought that syphilis might have been the disease that silenced the source of some of the most sublime sounds ever conceived offends our sense of cosmic harmony. Nevertheless, whereas Beethoven was an artist, he also was a man. It makes no difference to the disease that took him that his 9 symphonies, 5 piano concertos, violin concerto, 17 string quartets, opera, and 32 piano sonatas were some of the most brilliant ever composed. Nor did it pause to consider whether the deafness it induced might impair the composer's creativity or, on the contrary, enhance it by allowing Beethoven to hear the new brand of polyphonic music that was to be perhaps his greatest gift to mankind. Thank you for your attention. Now, we have time left for our string quartet to perform, and probably not time for questions. After, yeah, I'll be here for questions afterwards. Thank you for your attention.